Hi, I'm Dr. Alexandra Drakaki, an assistant professor of medicine and urology, the medical director of the GU Oncology program at UCLA and the Institute of Urologic Oncology. I'm happy to describe a case of an exceptional responder. So, as you know, as physicians, we're going through our training, we're start practicing. And what is really fascinating in real life practice is that there is no patient same to another one. Each one of our patients are unique, and many are inspiring us to continue to serve. So I would like to describe a case of a patient that I really met relatively early on in my career. This patient was followed by one of my colleagues for several years who left our team. And so the day that I was meeting her for first time, it was the day that she had restaging scans 2 years after her neoadjuvant therapy as part of a clinical trial and cystectomy. So up until that point, she was cancer-free, or there was no evidence of disease. But in that first introductory visit, I had to share the news that she was having recurrence of her bladder cancer, and the only treatment would have been chemotherapy. So she was only 48, she was healthy, and I started talking to her about dose-dense MVAC and all the expected complications. Now, I would like to give you some perspective that this conversation was happening around 2014, when we did not have that many treatment options. We used to just give chemotherapy and change chemotherapy regimens. So halfway through my description of what to expect, she just stopped me and almost started yelling at me. Like, I still remember vividly her looking at me with her beautiful curly hair and like staring and almost yelling. And she's like, there is no way I'm going to get a treatment to lose my hair, to get sick. There is no way you cannot find a treatment to keep me alive. I have a single child. He's in high school. I have to be there for him. There is no way I'm going to die. And that was the end of the visit. So in my mind, I was telling her, there is no way you're not going to die unless I can find a miracle drug. So at that time point, we were about to open a clinical trial with a single agent, phase 1 immunotherapy trial. So I called her back and I said, look, I have only one option, or chemotherapy. And of course, not many patients want to join a random phase 1 trial of a single drug that nobody knows about. But since that was her only choice, in order not to lose her hair, she just joined the program. Within a few cycles, her widespread metastatic cancer was melting away. She started playing soccer 3 days a week. And a few years later, she joined the graduation of her son in high school and later on in college. And now it's 7 years since that first visit. She has become a very close friend and good friend, and she's cancer-free and treatment-free. So as you can imagine, this drug went through all the steps and got approved by the FDA. It's one of the 5 drugs that we offer in the immunotherapy setting. And it was to me an example and a reminder that miracles do happen. We just need better miracles, better drugs, and hopefully we can keep more patients alive and let them join their kids in their graduations. So miracles do happen in medicine, but what is important part of the treatment is really this therapeutic relation between patient and doctor that really adds in this healing process.